Welcome to Adapting Plus. This is our video number 5, a critical care review for critical care nurses preparing to take the exams. This is a cardiovascular review that will be doing rapid fire, quick questions, 3 questions, I yield facts to help you master the cardiovascular aspect of your CCRN exams. Stick around and learn something. This is a quick question, but something you have to know as a nurse, critical care nurse. You've seen this multiple times. How do you read a question? Start it from the back, like I said, always, and go for the buzzword. What is the most likely cause of this finding? That means they want you to read the EKG. The client is recovering from what? Pacemaker insertion 12 hours ago. The client report what? These are the symptoms. That's what you have to focus on. Dizziness and lightheadedness, right? The EKG below was obtained. What is the most likely cause of this finding? Is it failure to capture? Is it failure to sense? Is it failure to pace or normal pacemaker function? If you look at it, I know you've seen multiple EKG, you can see that is normal QRS. You can see the normal QRS here. This is the normal QRS, and then you can see inverted P waves, right? But before that, you can see these spikes, right? These spikes are here. These spikes are here, right? But when you look at the rate, it's not slow. It's not slow at all. And sometimes you can see these spikes, it does not correspond to even the QRS or the PR and the P wave. That tell you there's something wrong. Look at the firing of this. It doesn't correspond to what's the atrial or the ventricular problem, right? It's just firing. And this is a problem. Look at another one is firing when the T wave is coming, T wave inversion. You can see it doesn't correspond at all. It's like off about something. It's keep on firing unnecessarily. What it means is there's a failure to sense. The pacemaker is designed to sense what your intrinsic cardiac function is doing. If we set it to a certain rate, when your heart rate is low, pacemaker will fire so that you don't become bradycardia. This is a normal, the heart is functioning well, but the pacemaker cannot figure out if the intrinsic heart function is doing its job. And this is the failure to sense, not failure to capture. Failure to capture means the pacemaker will fire, the intrinsic heart muscle cannot capture that signal to represent it. So you will see a spike before the P wave, but there's no P wave, or a spike before the QRS and there's no QRS. In this situation, there's more P wave in QRS than the normal spike. That means this is a failure to sense. You see, it's not failure to pace. Failure to pace, there's no pacing at all. I can see pacing, and this is not a normal function. Therefore, the right answer is number 2. This is the definition of failure to sense. Which of the following assessment finding is not expected with tension pneumothorax? The 65-year-old patient with the heart ARDS is on mechanical ventilator, right? A high pressure alarm is triggered and the nurse suspected a tension pneumothorax. We have tension pneumothorax. How would I know this is tension pneumothorax? Which one is not expected? If this is your airway and this is your lung and this is your chest wall, in tension pneumothorax, if there is air here, the air basically fills this lung, it pushes this lung, it causes tracheal deviation away from where the trauma is, not towards. The breath sound here is going to be diminished. This will push on your heart, and your heart will start having issues, right? It will basically start pushing the heart towards the right side. There will be congestion, and it leads to mostly right heart failure. So you can see signs of JVD, hypotension, and tachycardia. Therefore, I see hypotension, I see tachycardia here, but then diminished or absent blood sound on one side, mostly on this side. Tracheal deviation towards the affected side is not expected, right? Going towards that side is away from that side. So this is number one that we don't expect. And the last question, the patient is admitted to the ICU in shock patient. It can be different kind of shock. He's on mechanical ventilator. His vital sign shows heart rate of 120, consistent with the shock. Blood pressure 90/80, consistent with the shock. Saturation is okay on FiO2 50%. It's not doing well that much. But his cardiac output is 2.5, cardiac index 1.6, radial pressure is what? 14, and the wedge pressure is 22. Patient still has JVD and lung crackles. I've said this question before, but I want to keep on emphasize to be able to read cardiac function value to be able to diagnose the problem. If I see low cardiac output, I know it has to be somewhere hypovolemic or cardiogenic shock. If I see what cardiac index also low, it has to be more like cardiogenic shock, right? If I see signs of right heart failure, right, wedge pressure is high, and then you have right heart pressure is high, something has to come from the left to the right. It cannot be distributive. Distributive will not affect the heart function in terms of failure, right? There will be pump issue because now there's less fluid, right? But you're not going to have what wedge pressure and right heart pressure to be high in the distributive form. Obstructive, yes. In obstruction, there's going to be some form of that, but usually either cardiac tamponade or anything like that. There's nothing in the question that will give us the presence of lung function, rule out what obstructive form of it. And it cannot be hypovolemic because you're not going to have JVD. So this is all cardiogenic shock. This is how you can read EKG finding, cardiac index finding to be able to distinguish between the individual shock. And that is the key factor for your critical care nursing exams: cardiac output, cardiac index, wedge pressure, and right-sided heart, right atrial pressure. They are all high. The cardiac output is usually 4 to 6 liters. Cardiac index 2.5 to 4, 4. And then right atrial pressure is usually 2 to 6. So it's like almost 3 times double. And the wedge pressure is 8 to 12, is 22. So number 3 is the right answer. End of the 3 good questions on critical care nursing for you. Sorry, I put number 2, but that's number 3. Take care of yourself and good luck in your exams.